From the station working for you, this is WRTV News at 5:30, streaming now.
If you've had one, you know that COVID-19 tests can be quite uncomfortable. Ahead of 5:30, one company solution that could make testing easier and faster. Coming together for the good of the community. Ahead, how 3 groups are getting full meals to local families just in time for Thanksgiving. Lindsay.
Topping our lineup, the U.S. government is starting to distribute doses of an experimental drug to fight COVID. What it will take for you to actually get the medication. Marijuana legalization is now happening in states where many didn't expect it. Why typically conservative places are having fewer reasons to say no to the drug. And employers are trying to stop COVID from spreading into workplaces after Thanksgiving. Your boss may be asking you about your plans. A look at how much oversight your employer has on what you do outside of work.
Only on WRTV, there's growing frustration among Hoosiers over how long they're waiting for their COVID-19 test results. Working for you, WRTV's Rafael Sanchez shows us how one Indianapolis company is making key changes to make it easier for you to get a test and results.
It's a familiar scene throughout central Indiana. People drive up and get a nasal COVID-19 test, as some find uncomfortable. Now, one company is offering an option at their drive-up sites involving mouthwash and spitting into a cup.
Can you walk me through what someone would experience in their vehicle if they come to get this mouthwash test?
We will provide them with this tube that has a little bit of this mouthwash in it. So they will uncap it and swish around the mouthwash for about 45 seconds. They will then spit the mouthwash and the saliva back into the tube and then hand it back to the medical staff. And that's it. It takes a little bit longer, a few seconds longer than the nasal swab, but definitely less invasive.
Indy-based ARIA Diagnostics is the only one providing this type of test at its central Indiana locations. The company has seen an uptick in testing since government warnings, asking people to limit their numbers during this holiday Thanksgiving weekend.
Does this test have the emergency authorization that the FDA has approved to other entities to allow for this testing to occur?
It does. So this test is utilizing the same technology that the FDA and the CDC authorized under the emergency use authorization.
Working for you, Rafael Sanchez, WRTV.
You need to get a doctor's note if you want insurance to pay for the testing. To find out more info, you can call the number on your screen. That's 317-623-4003. The test costs $135 if you are paying out of pocket, and you will get your results within 48 hours. Kevin?
A dry evening, dry Tuesday evening, lots of clouds. We will have rain tomorrow and potentially quite a bit of it. 44 in Kokomo, 47 in Muncie. You can see how uniform the temperatures are. If you're starting travel this evening, we're dry through probably midnight. But tomorrow, just about any time you pick, rain is likely across the state. That's what we'll wake up to, widespread rain and temperatures in the mid-40s. Any rain tonight, you can see, is northern portions of the state, just north of Monticello, Logansport, and Peru. That continues to move north and east. It won't be till after midnight that we inherit a larger area of rain from the west and southwest. Probability of rain tomorrow, as you can see, sky high, 80% in the morning. We'll divide it this way. The morning hours are the most likely to have the heavier rain. The afternoon, evening hours, potential for an isolated stronger storm. There are the rainfall potential numbers, a little more central and south of I-70, or really south of a Terre Haute-Muncie line, and then a little less to the north and west. Lindsay?
Purdue Pharma is formally admitting to its role in the opioid crisis. Today, the OxyContin maker pleaded guilty to 3 criminal charges. Purdue acknowledged it had not maintained an effective program to prevent prescription drugs from being diverted to the black market, even though it told the DEA it was doing that. The company says it gave misleading information to the agency as a way to boost company manufacturing quotas. Health experts aren't just asking everyone to have a scaled-back Thanksgiving, they're doing it themselves.
Last year and the year before, we had between 20 and 30 people at our Thanksgiving table. It's absolutely my hands-down favorite holiday. This year, there are going to be 3 of us. There's me, my wife, and one of our sons.
That's the former CDC director, now head of the country's largest philanthropy on health. He will not be seeing his parents in person this year. They're in their 90s. Dr. Besser says Thanksgiving is different than holidays over the summer or Halloween because there's already stress on healthcare systems.
But just thinking about all of the people who will have other healthcare problems, people with diabetes and heart disease, someone who has chest pain and can't get into the hospital, people who may have cancer and aren't getting treated or screened. We have to do all we can to push through these next few months until there's a vaccine around.
You know, I'm sorry, I know a lot of people would like to get together, but remember, we really truly are talking now about being in a final stretch towards a vaccine.
Communicable diseases expert and college professor Jill Roberts, her oncologist husband and daughter will be the only ones in their home on Thanksgiving. They've been playing it safe this entire time, so Roberts' husband doesn't put any of his cancer patients at risk.
I'm definitely concerned about Thanksgiving. I want people to, be aware that it's a risk, protect the people who are the most vulnerable.
Experts have mentioned this before, but it's worth repeating. If you are having others over or going somewhere you don't live, the fewer people, the better. If you can, eat outside or open the windows in the house, wear a mask and socially distance as much as possible. COVID infections among children are rising. There were more than 144,000 new coronavirus cases among kids last week, and that's the highest weekly increase since the pandemic began, according to the American Academy of Pediatrics. There's a possibility those numbers could even go up more since the count is not complete. More in our lineup, 30,000 doses of an experimental COVID drug are headed to hospitals, but are you able to get it? We'll look at what it will take for you to receive a dose if you need it.
Now to a community-wide effort to show unity and charity just in time for Thanksgiving. Today, the D. Ross Foundation partnered with two other groups, the Ted Hardy Collection and Hood to Hood, to distribute complete Thanksgiving meals for families in need. The meals include a full-size ham. The meals, include a full-size ham, potatoes, and all the fixings.
Just important to show that we can work together and show that, hey, it doesn't matter what side of town you're on, we could come together for a great cause.
Organizers say they gave away enough food to feed at least 50 families.
30,000 doses of an experimental coronavirus treatment are shipping out today. It's Regeneron's antibody cocktail that got an emergency use authorization from the FDA over the weekend. It's also the same treatment President Trump got last month. Patients who are diagnosed early with COVID-19 may be eligible. The goal is to keep them from getting more sick so they don't have to go to the hospital, but the treatment still needs to be given through an IV.
The challenge is there has to be a place to administer it. So a place where you can have COVID patients in an infusion setting where they can be treated and monitored. This is not straightforward.
Any transfusion centers administering the IV will charge for those services.
The medicine itself is paid for by the government right now under the emergency use authorization. Those other charges have to be managed, and they'll be managed by insurance, Medicare, or Medicaid.
It's unclear if patients will need to request the treatment or if doctors will choose who to prescribe it to. In trying to get it to the areas that need it most, the federal government will work with states on distribution. But the problem is everywhere is seeing spikes right now.
We know that at least for 2020, the supply is going to be very low. So many of us in the infectious disease community and all the healthcare community are concerned that this resource be allocated in an equitable way.
After this initial rollout, Regeneron says it expects to have 80,000 doses ready by the end of the month, 200,000 by the first week of January, and then 300,000 by the end of that month. The FDA is expected to soon consider emergency use authorizations for two COVID-19 vaccines. The agency's advisory committee meets on December 10th to discuss Pfizer's vaccine candidate. Moderna says it's still waiting on some data before applying, which could be as early as next week. The FDA has asked the committee to reserve December 17th and 18th to consider that vaccine. Next in our lineup, many states that people didn't expect legalized recreational marijuana. Why there's been a shift in typically conservative places. Surveys show that upward of 70% of Americans plan to spend this Thanksgiving much differently than they historically have. Most families say they won't gather for the holiday, and a growing number are even opting out of cooking and are ordering a Thanksgiving meal instead. Alicia Nieves shows us how that's helping beyond reducing the spread of COVID-19 as restaurants work to rebound, reminding everyone they're open for business.
It has been months since restaurant kitchens have been this busy.
It feels awesome to come in and do what we do.
Richard Pagogi is a chef at the Delaney House restaurant and event venue in Massachusetts. He has spent the past week prepping dozens of turkeys after seeing a surge of to-go Thanksgiving meal orders, the result of more people staying home and not gathering this holiday.
Our country as a whole truly wants to do the right thing and get through this. I think people heed the warnings. I think people understand what's going on.
Delaney's is on pace to more than double the amount of to-go Thanksgiving dinners it sold last year.
This is what came in today.
On average, getting at least 200 new Thanksgiving to-go orders a day.
Oh, you'd like to place a holiday order?
We're one of those restaurants that before the pandemic, if you came here on a Friday or Saturday night, you had to wait an hour and a half to come in.
Peter Roscothan is the owner of Delaney's and says their to-go Thanksgiving order boost comes after the restaurant has dealt with a 75% drop in business.
It's hard to find money for payroll. It's hard to dig into your own reserves when you don't want to, but you have to kind of climb through this.
That burden is being relieved for a few weeks now. And what's more, it's giving his team glimmers of hope that they and other restaurants around the country can get through these difficult times.
It keeps us hanging on. And that's what we're doing. We're hanging on.
I am hopeful, and I think they're hopeful. They see something like Thanksgiving happen, and it's a little lift.
A much-needed lift and reminder of what better days look like, thanks to the sacrifice many are making by not gathering this Thanksgiving Day.
Okay, what can I get for you today?
I'm Alicia Nieves reporting.
Do you go all out for the holidays with your home's light display? Well, we want to see it. Submit a photo of your home's holiday light display for a chance to win tickets to the 2020 Christmas Nights of Lights drive-through light show at the State Fairgrounds. Your photo may also show up on the news at 7. The contest ends on December 6th. Go to the WRTV app for more details. And you can put a smile on a child's face this holiday season by taking part in the 20th annual WRTV Toy Drive. We are collecting new unwrapped toys at U-Store locations across Central Indiana between now and December 11th. You will also be able to donate your toys to WRTV personalities in person at several area Simon malls on December 5th. There's also more information on how you can make a financial donation at WRTV.com/toy drive. Kevin, it looks like you've got a toy ready.
So I'm in the holiday spirit, so I've had to put on the emergency brake. Before redesigning my home weather studio, I've got some things I'm going to hang over here. We'll bring the snowman out and anything else I can find. I'm waiting until Friday, so I'm just staying calm until then. I'll see you hopefully December 5th at one of the Simon Mall locations. I won't make it to every one. I'm not as fast as Santa, but I'll try to make it to at least a couple. As you look at the country as a whole, these are flight delays. Notice what's not happening. Most places without delays, and I saw ABC reported yesterday that airline travel is the highest it's been since the pandemic started. There's a 20-minute delay down in Dallas. Rarely do I show you this map. This is what we call a water vapor loop. It's available moisture in the atmosphere, but what's cool about it, look over the Texas Panhandle. See that little spin? That's the area of low pressure that will bring our wind-whipped rain to central Indiana during the day tomorrow. There's the rain now that streams from the southwest, from Texas, all the way to Chicago, and then it turns to snow as you get into lower Michigan. That snow is moving to the north and east. Warmer air winds out on the front side of this storm system. 48 in Indy. The wind out of the southeast at 12. During the day tomorrow, wind will gust over 30 at times. It's a strong south wind. That keeps our temperature into the upper 50s during the afternoon hours, and it brings deep moisture in. Lots of rain in the morning, Some of that will be our heaviest period of rain. Little break in the early afternoon and then some thunderstorm potential really between 4 and 8 tomorrow. There are your temperatures. You can see the trend keeping temperatures into the upper 40s. All of this leads to a dry Thanksgiving Day. Temperatures on Thanksgiving still in the low 50s, but noticeably cooler, but more importantly, perhaps dry across central Indiana.
The U.S. depends on the Strategic National Stockpile for emergencies, but months into the pandemic, the stockpile lacks important supplies. An NPR investigation found the stockpile is still in need of gloves, masks, respirators, and other PPE. Several things are to blame for these shortages, including a lack of manufacturing in the U.S., the global supply chain facing unprecedented issues, and high demand. The Department of Health and Human Services tells NPR it hopes to reach its goals by the end of the year. With paper products and cleaning supplies again flying off shelves, the people responsible for making them are pleading with us all to not panic buy.
And if you're getting your supplies from literally around the globe and you're moving products across countries and across borders, and there are certain restrictions in place, boy, that's a big challenge.
The American Cleaning Institute represents big brands like Clorox, Purell, and Lysol. It says companies are in a much better situation than they were at the beginning of the pandemic. They've made adjustments to keep employees safe, still get raw materials, and change production to adjust for high demand items. Brian Sansoni says there's no reason for panic buying or cleaning. The reality is there's more of these products available now than even a month or two ago.
Now, do take care of those high-touch hotspots, especially if there's a number of people in the household. Those are services like light switches, faucets, TV remotes, game consoles.
More than 500 products are listed on the EPA's website that can kill COVID. There's a lot more besides what may not be available at grocery stores. It also tells you how long it takes for the product to become effective to kill viruses. Republican stronghold states voted in favor of marijuana for the first time this election. Both South Dakota and Montana voted to legalize recreational use of the drug. Dan Grossman is looking into the shift happening around legalization in our country.
We could be trite and say support for legalization is higher than ever.
Once people legalize it, they like it. They like the prohibition ending.
But when you look at the numbers, it is difficult to point to the contrary.
It was no small number. This didn't just squeak by.
In former U.S. Attorney Brendan Johnson's state of South Dakota, the vote to legalize marijuana on November 3rd passed with 54% approval, while 62% of the residents voted to re-elect Donald Trump as president, a once partisan discrepancy that can also be seen in Montana, where 57% of the electorate voted for Trump and 58% voted for legalization.
Part of our state's libertarian streak, which leads people to believe, hey, the government doesn't have a role to play in this, and frankly, prohibition has not been effective, I think carried the day along with the real economic costs of continuing to build larger and larger prisons across the state.
According to Johnson, 10% of the state's arrests are for marijuana possession, oftentimes a few grams. He says it's a number that is seen in states countrywide and one that has swayed Republicans to vote for a bill they once may have not. In 1992, only about 25% of the party supported legalization, where today that number stands at 53%.
It became very hard to point towards legalization and say that there was anything that was moving the top line numbers.
Andrew Friedman helped implement Colorado's marijuana laws when the state became the first to legalize recreational pot in 2014. He says it became a case study for others who thought the drug would lead to more arrests, youth use, and crime. All things that never transpired, according to the Crime and Justice Research Alliance.
There's a lot of Republicans who believe in less government and who think that the war on drugs was a failure and would themselves be for legalization, but there were a lot of unanswered questions. And now more and more questions are getting answered, and so they're having fewer reasons to say no.
In 6 years, 15 states have voted to legalize recreational marijuana, while 35 have legalized medical use, a joint domino effect that Friedman only expects to roll into the future. I'll see myself out.
But I expect to see a growing course of Republican leadership that are looking for legalization.
I'm Dan Grossman reporting.
Finally, in our lineup with Thanksgiving, many employers are trying to reduce the risk of COVID spreading after the holiday. But can your boss ask you about your plans? We look at what your employer can ask and if they can have any bearing on what you do outside of work. As our country works to rebound, companies are managing the pressure of keeping workplaces safe. Employers are taking precautions ahead of Thanksgiving with concerns about the holiday spreading COVID-19. Companies are doing everything from issuing memos reminding workers about the public health guidance on gatherings and travel to asking workers to sign pledges that they'll keep their gatherings small. But there are limits to how much say your boss has on what you're doing outside of work.
They are allowed to inquire about what their travel plans might be or what their off-duty conduct might be, and they can ask employees to disclose that information.
Employment attorney Christine Lamb says many states prevent employers from discriminating against workers who are doing things outside of work that are lawful. But if you aren't following policies your work put in place for COVID, they can ask you to go through some type of coaching or counseling. She advises companies against checking in on their workers on social media.
You might have an employee who is at a gathering of 50 people and they're not posting anything on social media. The employer might not know what's going on, but then another employee that posts a photograph of them with 10 people on social media, there's just a risk of that unequal application of the rules.
She says one thing employers should be thinking about now is what does next week look like for the company post-Thanksgiving. That includes having a plan for people to work from home if that's possible. One drug maker tells the Wall Street Journal it's offering workers a paid 2-week quarantine if they need after the holiday, where they will be expected to work from home. A spacious beach this holiday sounds pretty good, doesn't it? Well, researchers now say the value might be a lot more than just beauty and fun. Tomorrow, the new advances that make researchers think they can turn seawater into renewable fuel.
And with all the rain in the forecast during the day tomorrow, that should lead to a moist turkey. At least Thanksgiving Day will be dry. Mostly cloudy, 52. We're still dry.